Welcome back. This is Neurofeedback Foundations, Module 36. And today we are going to be talking about continuous performance tests in the evaluation of individuals with problems of attention, executive function, and memory. So what are continuous performance tests? They are an objective way to measure the different aspects of attention. During a CPT, the client or the patient is instructed to respond only when the target or stimulus is presented and to withhold responses to other stimuli, and they may be visual or auditory or a combination of both. Now, attention is a fundamental part of cognitive functioning. If you can't pay attention to conversations or what you're reading or the work at hand, you are going to experience some dysfunction in life, obviously. So it is an integral part of testing for ADHD, but they're also helpful for other cognitive issues, such as individuals that have had encephalitis, stroke, brain tumors, dementia of various types. And they are very helpful for neurofeedback practitioners to assess baseline function as well as change in function over time. So in our clinic, we will administer three different continuous performance tests, and then we will take the two that the client performs the worst on and use those to reassess the client after 20 sessions, neurofeedback sessions, and then 40 and then 60 and so on, depending on how many neurofeedback sessions they are going to need. Usually they're administered on a computer, and they typically last anywhere from 15 to 20 minutes. So we're going to take a look at the three that we use. We use the Connors CPT-3, the IVA-2, and the TOVA continuous performance tests. So you can go to each of the websites to really do a deep dive, but I am going to present to you today the overview. So we're going to get out of this. Oops. And I am going to start with the IVA, and we'll watch this.
The diagnosis of ADHD can be challenging and requires considerable clinical expertise and experience. There is no single test that can be used to diagnose the disorder, and there is no gold standard defining exactly how to differentiate it from other mental health issues. As Dr. Russell Barkley once jokingly said, the only way to truly diagnose ADHD is to assign a person a book report, lock them in your office for a week, and then come back a week later to see if it's done. Barring trying this unusual assessment approach, healthcare providers such as psychologists, pediatricians, and psychiatrists follow the guidelines found in the DSM-5 to diagnose ADHD. They typically assess whether a client has trouble sustaining attention, impulsive behavior, low frustration tolerance, poor academic or job performance, difficulty planning, and a number of other factors. The clinician often uses a variety of psychological testing instruments to help determine whether the client's symptoms are due to ADHD as opposed to, or comorbid with, other disorders such as learning problems, anxiety, or depression. Since the diagnostic criteria require that a certain number of ADHD symptoms must be present in more than one setting, rating scales completed by parents, teachers, or other people who know the individual well are the recommended tool of choice to help clinicians make this diagnostic decision. New research has found that almost 50% of people who have ADHD go through their lives undiagnosed. These individuals never receive any treatment and continue to suffer due to their impairments. Statistics show that, left untreated, ADHD leads to a significantly higher mortality rate, higher probability of alcohol or drug dependence, and a greater likelihood of criminal activity and incarceration. Yet, a large number of people still discredit the seriousness of the disorder, and some are even skeptical of its very existence. Clinicians have told us that often when they report an ADHD diagnosis to the father of an ADHD child, the father will say, "Oh, he's not ADHD, he's just like me." To counter such skepticism, clinicians often find that concrete, objective test data can be very helpful. Many diagnosticians include continuous performance tests when additional testing is considered useful in helping to corroborate their clinical opinion. While CPTs are not considered to be vital in the diagnostic process and would never be used as the single deciding factor, they can provide the clinician with useful, objective, norm reference data to share with parents and other professionals. BrainTrain's IVA-2 CPT is unique in that it combines tests of visual and auditory attention and response control in one instrument, then reports the separate scores related to each of these modalities. In this sense, the IVA-2 test is like 4 CPTs in one. The IVA-2 is also unique in that it has been validated in published research that compared it to fMRI and qEEG data. Used worldwide, the IVA-2 is approximately 13 minutes long and is normed for ages 6 to 96, divided by age and gender. There are 1,700 records in the IVA-2 normative database. In creating the database, the researchers screened out individuals diagnosed with neurological or attention problems to give the test greater power in differentiating between individuals with attention disorders and normal individuals. Norms were collected in various areas of the United States, and a variety of racial and economic groups are represented. Here's how it works. The IVA-2 presents a series of 1s and 2s in a pseudo-random pattern, sometimes spoken out loud, sometimes appearing on the screen. 1. The client is required to click the mouse when he sees or hears the number 1, and inhibit clicking whenever he sees or hears the number 2. While seeming random, the test stimuli are ordered in such a way as to set up patterns of responding and non-responding. The test periods where the 1s, or targets, are presented continuously are referred to as high demand blocks. In these high demand blocks, the sudden presentation of a 2, or foil, pulls for an error of commission or impulsivity, since it requires the test taker to break his pattern of continuous clicking and suddenly put on the brakes. During the low demand blocks, where the 1s are infrequent and the 2s, or foils, appear continuously, an inattentive test taker may drift off and thus fail to respond when a target appears. Since the high and low demand blocks switch back and forth 9 times during the test presentation, and the stimuli shift between the visual and auditory domains in a pseudo-random presentation, the IVA-2 requires working memory and mental flexibility. The test creators felt that this type of flexibility mirrors the attentional demands of real life more realistically than other CPTs, which test visual and auditory modalities in completely separate test administrations. Also, because the test is fairly long, quite boring, and requires constant go, no-go decision-making, it demands significant mental stamina and provides a measure of sustained attention. The IVA-2 gives you 9 reports and 10 data analyses to choose from, including research-based malingering scales for adults. Each IVA-2 test administration includes free, online, self-scoring DSM-5-based ADHD rating scales for parents, teachers, or self. These can be completed on an iPad, a PC or a Mac, or even on a smartphone. The completed rating scales data are uploaded back to you. All data are securely encrypted and no identifying information ever goes online. And since the rating scales are scored automatically and the data load right into your IVA-2 report, you save time. Research studies provide strong evidence of the sensitivity and validity of the IVA. For more information about IVA research, visit braintrain.com/IVA research. Try the IVA 2 for yourself. You can get 2 free IVA 2 test administrations by completing the test qualification form at braintrain.com/pro-trial.
Okay, so that was the IVA 2. Now we're going to take a look at the TOVA. The next test we're going to cover is the TOVA test. The TOVA test is another form of a continuous performance test. And this one is language free, so it is just visual. It does not require any left-right discrimination. The test, it tests many of the same things as the IVA. It calculates response time variability, which is consistency, response time or speed, commissions, which is a measure of impulsivity, omissions, which is a function of focus and vigilance, and they are also compared to age and gender matched normative samples. The TOVA test is fairly simple. This is one of the longer tests. It is 21.6 minutes long. And what happens is there are stimuli that are presented, and the individual is instructed to only click on the target when the small box is in the top and not the bottom. The age is administered as young as 4 years old, and it's a shorter test. It's a 10.8 minute test for 4 to 5.5, and then it defaults to the longer test for older ages. And I will just play this short video to it. This will just walk through the instructions for you.
Welcome to the TOVA test. Hold the button in your writing hand with your thumb resting left.
Sorry, we'll let this load here. There we go.
Lightly on top of the button, like this. When you press the button, let up as soon as you hear the click. You don't have to hold it down. Press the button when you're ready to continue. This test measures your ability to pay attention. 2 different squares will flash on the screen. One square has a small black square near the top, and the other has the small square near the bottom. The squares will flash on the screen, like this. Press the button as fast as you can every time you see a square with a small square near the top. And don't press the button when the small square is near the bottom. Once again, press the button only when you see the small square near the top. Don't guess which square will flash. Make sure you see it before you press the button. Try to balance speed and accuracy. Press the button as fast as you can, but also try not to make any mistakes. If you do make a mistake, don't worry. Anyone can make a mistake on this test. Let's review. Press the button as fast as you can, but only when you see the small square near the top. When you press the button, only press it once and don't hold it down. Just click the button. Finally, don't go too fast or try to guess. Take enough time to see which square it is.
Okay. So I'll let you come to tovatest.com to explore the more features of this really great test. Lots of manuals and guides that you can access on on their website to learn more. Now we're going to go over to learn about the Connors.
Here to administer the Connor CPT-3, you insert the Connor CPT-3 software key into the test computer and you access the program by clicking on the MHS scoring software icon. The very first time you utilize the Connor CPT-3, you will need to install and activate the software according to the step-by-step instructions provided to you along with the software. Prior to every administration of the Connor CPT-3 and Connor's CATA, you will want to close all other programs on the test computer to maximize the probability that the administration will run efficiently and without disruption. To minimize distractions during the administration, it is important that the testing occurs in a quiet environment with minimal distractions. Given that the administration time is 14 minutes and cannot be paused, it is recommended that you ask the respondent to visit the washroom and or have a drink of water before the administration. In addition, it is recommended that you ask the respondent to discard any gum or candy prior to the administration. Once you are ready to begin the assessment, in the MHS scoring software, under the new assessment menu, you would select the Connor CPT-3. You then enter the respondent's name and or ID and demographic information, and then click OK to enter the practice test. If you are retesting someone that you have previously tested with the software, you would select Load Profile and then select the correct respondent from the saved profiles. Once you select OK, you are brought directly to the 1-minute practice test. When the task instructions appear on the computer monitor like this, the instructions should also be explained verbally. Although the task instructions for the Connor CPT-3 are very simple, some individuals, such as young children with reading comprehension difficulty, may not understand the instructions without further explanation. The Connor CPT-3 manual includes a recommended script to further explain how to complete the Connor CPT-3 for those individuals who may have difficulty understanding. Once the instructions are read, it is time to begin the practice test, which runs for approximately 1 minute. During the practice test, the administrator should observe the respondent carefully. The administrator is responsible for deciding whether the respondent is ready for the actual administration or should practice again. However, the software will provide guidance to help inform this decision. Welcome to the Connor CPT-3 practice administration. Press the space bar for all letters except for the X. Please respond as quickly as possible, but also as accurately as possible. When you click OK, the practice administration will begin. The respondent should proceed to the actual administration if no warning message is issued at the end of the practice test. If a warning error is issued, it is recommended that the administrator choose practice test again and re-explain the instructions to the respondent before repeating the practice test. If task comprehension does not improve after 3 attempts, consider foregoing the actual administration. After the decision is made to start the actual administration, ask the respondent to refrain from asking any questions until the administration is complete. During the Connor CPT-3, remain in the room to observe the respondent. If the respondent asks questions during the administration, deal with questions quickly, and the standard answer to almost all questions should be, "I can answer that question after you are finished. Please continue." In cases where the respondent is disengaged from the task, a one-warning approach is used. It is suggested that when the respondent disengages, you make one effort to reorient them by saying a verbal prompt such as, "Remember, you have to try paying attention the entire time." If the respondent continues to disengage from the task, no further prompt should be given, and the program can be terminated by pressing Ctrl+Q simultaneously on the keyboard. Let's take a look at what the actual administration looks like. Welcome to the Connor CPT-3 administration. Press the space bar for all letters except for the X. Please respond as quickly as possible, but also as accurately as possible. When you click OK, the administration will begin. Once the administration is completed, the program advises the respondent that they have completed the assessment and to please ask for assistance. The administrator then enters a password to proceed back to the Connors CPT3 software main menu. At this point, you would choose to either discard or save the assessment that has just been completed. Once at the main menu, you can generate a report by selecting Generate Report and choosing what type of report you would like to generate, assessment report or progress report. And here is your Connors CPT3 assessment report.
There are many other continuous performance tests. These are the three that we find the most useful in our clinic. I did want to show you one other that I know a lot of neurofeedback clinics use. Show right here. So this is CNS vital signs, and this is actually a compilation of multiple different continuous performance tests. They also have rating scales built in. I feel like CNS vital signs would be a great addition to practices where there is not a lot of time to do intake and testing, perhaps like a homeless shelter, a drug rehab, other places that this might be extremely helpful for would be juvenile detention centers, prisons. So I did want to introduce this to you as well. And obviously, if you find others that you feel are extremely helpful for your particular practice, especially if you're doing occupational therapy or physical therapy, I think that that's wonderful. So explore, look around, find what's best for you and your practice, and happy hunting.